Psychosis is a complex medical condition affecting how a person's brain processes information. It can significantly alter thoughts, perceptions, and behaviors. Understanding psychosis is crucial for individuals, families, and communities. Psychosis is a state characterized by a disconnection from reality. Key symptoms include hallucinations, which are seeing, hearing, or feeling things that aren't there. Delusions are strong, false beliefs not based in reality, despite evidence to the contrary. Disorganized thinking and speech are also common, making communication challenging. These experiences can be very distressing and frightening for the individual. They are not a sign of weakness or a character flaw. Psychosis can occur in various mental illnesses, such as schizophrenia, bipolar disorder, severe depression, psychotic depression, schizoaffective disorder. Psychosis may result from a variety of biological, psychological, and environmental factors. Mental health disorders, schizophrenia, spectrum disorders, bipolar disorder, major depressive disorder with psychotic features, neurological and medical conditions, brain tumors or lesions, epilepsy, Alzheimer's or Parkinson's disease, HIV/AIDS, syphilis, lupus. Substance-induced psychosis, alcohol or drug abuse, LSD, cannabis, methamphetamine, withdrawal symptoms. Genetics and family history, increased risk if a family member has a psychotic disorder. Stress and trauma, severe trauma or abuse, especially in childhood, PTSD or acute stress reactions. The exact causes of psychosis are not fully understood, but they involve a combination of factors. These include genetic predispositions, brain chemistry imbalances, and environmental stressors. Substance use can also trigger or worsen psychotic episodes in some individuals. It's important to remember that psychosis can affect anyone, regardless of background. It is a medical condition, much like diabetes or heart disease. Positive symptoms, things added to experience, hallucinations, auditory, visual, tactile, delusions, paranoia, grandiosity, false beliefs, disorganized speech and thought patterns, bizarre or inappropriate behavior. Negative symptoms, loss of normal function, lack of motivation, social withdrawal, flat or inappropriate emotional response, poor hygiene or self-care. Cognitive symptoms, difficulty concentrating, poor memory, trouble with decision-making. Diagnosis involves a combination of clinical interview and observation of behavior, mental status examination, psychological assessments. Ruling out medical causes through blood tests, imaging, MRI, CT, or drug screens. Early intervention is paramount in managing psychosis effectively. Recognizing the signs and seeking professional help quickly can significantly improve outcomes. If you or someone you know is experiencing symptoms, please reach out to a healthcare provider. This could be a family doctor, a mental health professional, or an emergency service if there is immediate danger. Timely assessment and diagnosis are vital steps toward recovery. Treatment depends on the cause, severity, and individual needs. It often includes medications, antipsychotics, e.g. risperidone, olanzapine, haloperidol, mood stabilizers or antidepressants if bipolar or depression-related, psychotherapy, cognitive behavioral therapy, CBT for psychosis, psychoeducation for the patient and family, trauma-informed therapy if relevant. Hospitalization may be needed during acute episodes for safety and stabilization. Supportive services, case management, supported employment, peer support, housing assistance. Supportive therapies like family education and social skills training also play a crucial role. With proper treatment and support, many individuals can achieve significant recovery and lead fulfilling lives. Early identification, early psychosis intervention programs, EIP, improve long-term outcomes. Recognizing signs like social withdrawal, unusual beliefs, or sensory disturbances is key. Managing risk factors, avoid substance abuse, manage stress effectively, regular mental health checkups for high-risk individuals, medication compliance. Continuity of care and sticking with treatment significantly reduces relapse risk. Psychosis affects approximately 3 in 100 people at some point in their lives. First episodes typically occur between ages 16 and 30. Schizophrenia affects 20 million people globally, with psychosis as a core feature. Early treatment within the first 6 months of symptoms is linked to significantly better outcomes. Living with psychosis can be challenging, but no one should face it alone. Support from family, friends, and community resources is incredibly valuable. Empathy and understanding are essential in creating a supportive environment. Let us work together to challenge the stigma surrounding mental health conditions. Education is a powerful tool for destigmatization, fostering acceptance and encouraging help-seeking behaviors. Psychosis is a treatable medical condition, and hope for recovery is real. By increasing awareness and understanding, we can create a more compassionate society. Remember, reaching out for help is a sign of strength.